All right, hi everyone, and welcome to Next Gen Tips and Tricks Patient Portal. Today we're going to talk about the Patient Portal. So Next Gen Patient Portal, it's a secure internet portal that enables patient, provider, and staff communication. So for example, requesting appointments, requesting medication refills, requesting/reviewing test results, completing online forms if available, viewing documents, and accessing health reference information, for example, patient education. And here's the link for the patient portal, and this is how it looks like. Patient enrollment. How do I enroll to patient portal? So there has to be an issue of a token. So clinic navigators or front desk can enroll and provide a token. And we could see the enrollment here. So we send an invitation link to the email address. If patient receives the link via email, they can then enroll into the patient portal. If that token does not work, a new token can be issued, and the previous token will be expired and not work. So patients can also self-enroll via the NextMD website, and patient will need to install/download an authenticator app. And 6-digit portal code will be provided to complete the login, as seen here. And here's some more images. For example, if they need to reset a token and or enrolling as well. Good question, Darcy. Yes, if a patient doesn't have a token, you can route them to the front desk, and they can assist with setting up that, like, for example, getting their email address and sending them a token. So message categories. So this is on the patient's side. So there's different categories which they can send a message to us. For example, personal medical record requests and results such as labs or diagnostics, contact/information update, patient information update. So support staff can assist with updating contact information under demographics. Medication questions such as medication refill requests. So these would be forwarded to the PCP prescribing provider. New medications requests. So we also forward those to the PCP or reply to the patient suggesting an appointment to speak with the PCP. And also referral questions. So patient requesting new referrals or new/complex referrals. So if they're requesting a new referral, if the patient spoke to a provider about a referral or is requesting a new referral, message can be forwarded to the PCP. If not, if it is a new/complex referral, the patient will be asked to schedule an appointment to speak with their provider or PCP. And this is how it looks. Providers/support staff in patient portal. So how to locate the patient portal. So click on inbox. And then there's a patient portal tab. Provider and support staff can send records and results. So such as lab results, radiology reports, documents generated, for example, work/school notes, patient plan. You can also approve medication renewal requests and communicate with patients, for example, answering questions or giving them instructions/patient education as well. So if you want to compose a message to send to a patient, just open up the inbox and go to the patient portal tab. Next, on the bottom, there is a compose button here. And then this box will open up. So you can write your message here under this space here. Then you have options. So you would have to click on where it says to, and then you could add, depending on if you want to send it to a user, or user being here in the clinic, like a staff. If you want to add the patient here, you would click to add the patient. And then you would go to send and chart. So right here, after you add the patient, this will be ungrayed out. And then you can add depending on if you want to add it to a new encounter that's locked, a new encounter that's unlocked, add to the original unlocked encounter, or if you don't want to add it to the chart. And then it will give you options if you do have some encounters open. And then once you send it, it goes through. So any questions on this? So Rigo from front desk said that front desk is doing email invites now mostly. If the patient doesn't receive their link in the inbox, please inform them and check their spam junk. Also, a link can take 15 to 20 minutes to be received. Thank you for that information, Rigo. Replying to inbox messages of patient portal. So under inbox again, remember to select the message patient portal. Here you'll see the message with the sealed envelope. Double click on it. That will open up the message. And then you click the accept with the little drop down arrow and you'll get 3 options. So you can either accept and reply, accept and reassign if that message wasn't deemed to go to you, or accept and mark as complete. For example, if the patient is just saying thank you, you can just accept it and mark it as complete, or you can reply to them as well. You can also forward the message, which is this blue forward button arrow. And you can access the patient's chart if you want to review anything from the chart. So just click open chart and it should open up the chart. The send task, this option will only appear, which is here, as soon as you accept and reply to the message. So you can send a task to another user or staff here at the clinic. So once you accept and reply, you can then send in chart. So you would follow the same steps as down here, send in chart, and you can choose if you want to save it to a new encounter, and which is being locked, a locked encounter, an unlocked encounter, or add it to the original unlocked encounter. So it's here. So attaching notes / documents and sending labs imaging and documents. After selecting accept and reply, you can click attachments on the top, and you can add different attachments such as add document, add an IMH questionnaire, add a template, add files, which files are the ones saved in your PC. Or you can remove anything you have added as well. Number 2 is send in chart. So you would just click send in chart and it would send those documents that you have attached. The other way to send labs imaging reports and documents generated within NextGen is you go in NextGen and, for example, if you have these labs results all generated document already, so you can just right click and you should get this pop-up and just click send to patient portal. Then you get an option to either write a message here if you want to write a message to the patient, or if you don't want to write anything, just click send and it should send those documents to the patient. If you want to double check to make sure that was sent successfully, you could always right click again on that document and click patient portal history details, and it should say your name and the time that you sent the document. So EMR trainer and patient portal. EMR trainers have access to all the portal messages under all messages categories. So here. So providers begin a new message to a patient and it is addressed to Venice Family Clinic. We will get that one and we should forward it to the PCP or provider or person that is designated to. Or providers can select for patients and reply to them directly sent to them. In addition, call center, QI, and Dr. Loaz are also assisting with replying / forwarding appropriately to these messages as well. I think that's the last slide. Yeah, and if you have any questions or further assistance, you can always email us or at these extensions. Any other questions, or do you want me to go back to anything that I went too fast on? I'll stop the recording.